Being a first-time mom is scary. There's so much overwhelming information and opinions flying your way from every direction. Finding a healthcare practitioner you trust to help guide you through what's normal versus what's common for babies will not only help ease your mind, but help your baby be at his or her best too. Today, I'm chatting with pediatric chiropractor Dr. Alima Rahman about common conditions in babies that often go untreated in the name of normal or it'll work itself out mentality. Welcome to My True Health Podcast. I'm Michele Scarlet, board certified functional medicine practitioner, functional diagnostic nutrition practitioner, certified personal trainer, and women's health coach. I'm here to help women achieve true health by deep diving into their symptoms that often go ignored or dismissed. Join me and other experts in the women's health space as we uncover the truths around all things women's health. Hey everyone, and welcome back to my True Health Podcast. I'm so excited to introduce you to Dr. Alima Rahman, a chiropractor who is engaged in supporting families through their postnatal journeys. She is honored to serve new and seasoned parents through the incredibly complex adventure of parenthood, and as a pediatric healthcare provider, she aims to provide care that fosters overall well-being through all stages of growth. And to top it off, just how amazing she is also committed to global healthcare, treating underserved communities in remote areas of Africa. Welcome, Alima. Thank you so much for being on my show today.
Hi, thank you so much for having me. I'm so
How
excited to be here.
great. How are you doing?
I'm so good. Yeah,
Good.
well. How are you doing?
I'm well, thank you. So, before we dive into all things baby, can you share with my listeners a little bit about how you ended up specializing in pediatric chiropractic care?
Yeah, so I treated adults for about a decade, and within that process, I had two kids. And it sort of changed everything in the whole world.
It does.
Yeah, as it does.
Yep.
And through that process, I took time off work. And um, of course, as a healthcare provider, I had my kids seen. In my case, they were seen by an osteopath, and she's just this incredible osteopath who trains most osteopaths in Canada. She's trained my sister, and actually, I ended up shadowing her quite a bit during that time and learned so much about how we can, help our babies through difficult times. And it just gave me a really different perspective and a really different understanding about babies and how much we can really do. And so that's where I started to focus on that piece. And when I went back to work after homeschooling my kids and being off with them, I didn't want to just go back to anything. I wanted it to be meaningful and something that I was really passionate about. And so I ended up at Una treating babies mostly.
That's amazing. And I mean, I know how fantastic you are because you are caring for my son at Una.
Yes.
Um, and honestly, every time that I come to see you, you are so in your element. Like, it feels like that is exactly where you are meant to be. Is that how you
Yeah,
feel about it?
it is. It's an interesting thing because my husband says to me, who could take that much time off and have it benefit their career? I took so much time off, and all the time off, every time I was rocking my child, helping them go through fussy times, working on their digestive system, helping them through, this, that, or the other, it was benefiting me in this place, in the space that I've found and working with the little ones. And it's this world I feel like is underserved.
Oh, big
And yeah, big time. And I just love the little ones so much. So it's a true joy for me, to be honest.
That's amazing. Well, taking time off, being a mom is not off. I know you took it
No,
from your career, but
no,
it
not
was
all.
almost
Yeah,
like your education continued,
exactly.
and that's how it propelled you into this part in your career now.
Exactly. Yeah,
Yeah,
exactly.
yeah,
What
that's
a
amazing.
whirlwind.
Yeah, what a whirlwind. Yeah. Speaking just about that, your kids are a little bit older than my 1-year-old, but
Mm.
you and I are both in the middle of this thing we call motherhood.
Yes.
I was thinking prior to getting on here today, what are some words that I would use to describe motherhood? And
Mm,
I came up with beautiful. I came
mhm,
up with absolutely terrifying,
mhm,
overwhelming, and joyous, to name a few.
mhm.
How would you describe motherhood?
I remember having a photo of my daughter when she was not yet 2. She was maybe not even 1. She was in a little rocking chair, and just thinking every little itty bitty piece of my life has changed forever.
Forever.
And I also always say, "Oh my gosh, like, it's so wonderful, this journey, but it's hard, and it's exhausting, and it's beautiful, and it's, overwhelming, and it's more rewarding than you could ever imagine." It's just this whole mix.
It really is every end of the spectrum when
Yeah.
it comes to emotion. Like you
Yeah,
can be, overwhelmed and angry at one moment and like sobbing on the floor because you just love them so much the
yeah,
next.
yeah, and at the same time,
Yeah.
it's not
Yeah.
even mutually exclusive. And it's interesting because I love now having this perspective. I'm treating babies a lot of the time, but I have a 9 and a 7-year-old, and it gives me a different perspective even now. I was just telling my husband, imagine if, we were in it, we had a baby now. How would we be different? How would we view things differently? Not even parent differently, but just perspective. And it shifts every moment, it shifts and it's evolving. And I think as a mother, I can't necessarily speak for fatherhood, but I think inevitably we go through this identity shift.
Oh, big time.
No, there's no way around it. We are now a mother.
Yep.
And I think a lot of times we're expected to just have that identity. And we always have to find our way back to the woman we are
Sure.
and not just be mom and wife. And I think that journey is particularly fascinating and one that every woman has to go through after having children. And it's just like the journey of a lifetime. It's,
That's a great way to describe it. And you know what? I think if I think back to the last year, or
Mhm,
even when I was pregnant with my son, I was
mhm,
so determined to not let it change my life. I was like,
mhm.
"No, I'm not, I'm not gonna be that mom."
Yep,
And fast forward, now my son's a year, and I'm so happy that it changed my life so much.
exactly.
Like, I
Yeah.
wouldn't trade it for anything. And,
Mhm.
that piece that you just said about coming back to the woman that you were,
Yeah. Mhm.
I don't feel like I'm there yet. I'm still very
Yeah.
much sort of immersed in my little one.
Yeah.
But I do know eventually, of course, as they get older and they become more independent, you have to hold their hand rather than hold them in your arms. You know what I mean? So you separate,
Yeah.
yeah. You separate a little bit more and you will have your world back, and not losing that is important for sure.
It's interesting because as much as I say we have to find our way back, I also, if I can frame it a little differently, I think we'll never be the same. It's almost like evolving through into
Right.
someone. And so, gosh, it's not easy always, but it's fascinating, it's intriguing, it's juicy.
Yeah. So
There are
when you
pieces of yourself you'll never, discover if you don't go through that, right?
Yeah, yeah, for sure, for
Mhm.
sure. And you're right. It will evolve. And I think forever it will evolve.
Forever.
Imagine you didn't, how boring life would be,
Yeah.
right? And you know what? You couldn't speak to fatherhood, but if I think about who my husband was 10 years ago and who he is today, like,
Mm.
you know, I think they say something like you marry seven different people in your life based on who you evolve into and who he evolves into, or your partner evolves into. And I think that's just important through every
Yeah.
phase.
Mhm.
So when you first became a mom,
Mm.
how did you feel? You said you took your daughter to an osteopath. What was that experience like for you? Why did you go to an osteopath to begin with?
I know I honestly don't recall exactly what it was for. I would imagine it was, if not just for wellness care, because
Okay.
my sister is an osteopath, and um, we just knew she was an incredible practitioner. But I think it was probably just digestive upset
Mm.
for her. When I first had my daughter, it was bliss, to be honest. Where I had some challenges was just dealing with all the opinions and like all the noise and all the other people. If I was home with my baby, I was as happy as I could possibly be. But I think you have to have kind of a thick skin right now when you have a baby. Um, because I mean, I was just trying to learn my baby, and my baby was learning me. And to be honest, she was the type of baby who, if she was with mommy, she was fine. And if she was not, she was probably crying.
Yeah.
And so there was some figuring out there. And
And that didn't mean that there was something wrong or that
no,
it was
absolutely
like,
not.
oh, immersion therapy, you should just be taken away to get used to not being
No.
with. That was a lot of advice I got. Yeah, and you're like, this little infant is like 3 days old. How is that
Yes.
possible? No.
No. So we just wanted to bond and be together. And I think a lot of people had a lot of opinions about that. So if I was just home with my baby, I think a lot of the noise caused me some anxiety. But when it came to going to the osteopath, um, I think it was for digestive upset and to just get her checked. And it was a wonderful experience. It's a very gentle approach, as is my work, um, as you know, which
Yes.
is one of the things I think people may not realize about what I do. They think chiropractor and they think, oh, maybe it's not so gentle. But to be honest, my touch with the infants is incredibly soft and slow and
Oh,
gentle.
yeah.
And it really just they drive everything. So if they're not comfortable, we're like, babies don't often cry in my office. It's a very relaxing space, and I'm always sensitive to their mental state as well as their physical state. And yeah, it was an incredible experience of learning for me to have gone to the osteopath and just understand what can be treated, honestly. I think
Yeah.
a lot of us think, oh, they're babies. They're gonna cry. They have to be held all the time. Just sort of brushed off. But no, the reality is babies, infants who are quite comfortable can be put down without crying, and they can be quite content. And so that was a whole journey for me to learn and get through that space of like learning my baby and their bodies and their emotional states and all of those things.
Yeah, I think that people forget or maybe just don't understand that babies are their own humans.
Yes, I
They
say that
have
all
their
the
own
time.
emotions. They have tension just like you do if you sleep wrong, if and I mean, if they were just either pulled out of you or you pushed them out of you, they have come through a tiny little space of the most bony areas of your body. Like, how could they not be tense? Then all of a sudden they're in this world where they're cold and they feel this thing called hunger and they don't understand anything, their bodies are going to feel that. So I think that, you know, saying, oh, just let them cry or it's totally normal for this or that, I, I I feel like I disagree so much more now, having gone through the last year with you with my son,
Yes.
because he is his own little person in every other way except for when he cries. Like, that's just
Mm.
normal? Like, that's not
Yeah.
like, that
Yeah.
doesn't seem right, right? That's part of the
Yeah.
reason why I felt it was so important for you to come on today because, like, obviously my son has a pediatrician, but coming to see you once a week, once a month, or whatever it's been over the last 8 months, you have taught me so many things just through our conversations and then the way you treat him. You have taught me so many things that have helped me feel more confident as a mother and feel more confident in his development. And I think that
Mm.
not a lot of new moms, even seasoned moms, understand that or I don't know, we said just like before I hit record, when you're a new mom, you're like kind of in this freeze state. Like
Mhm.
you're overwhelmed, your hormones are wild. You don't want to be that mom that worries about every little thing, but like maybe you feel like something's wrong and you don't know where to go. Your doctor tells you things are fine, your mother tells you things are fine. You know, like I feel like you have to find your people. You have to
Mhm.
trust your gut and you have to find somebody, a healthcare practitioner who, like you said, part of the reason you went to see an osteopath was just like wellness. Like, could my baby be more comfortable? Like, don't we
Mhm.
all want that for our
Yeah.
child, right? Like, if there is some
Yeah.
way to make them help them sleep better, help
Mm.
them, just feel better, no pain. Lots of babies have tons of gas, in the first early months. Their digestive system's just getting used to milk. I mean, I just feel like we're brushed off. There's not a lot of postpartum care, and you're
Yes.
just kind of expected to leave the hospital and go like, okay, go care for this life.
Yeah. I remember walking out of the hospital and just saying to my husband, "They're just gonna let us leave with this child? Like, they're just gonna let us go with a whole new human?"
I thought people would for sure like check my band, like my wristband, and like check his, and nobody did. And I was like, oh, not a single soul is looking at me walk out of this hospital right now. It is a people that are underserved, postpartum moms, babies.
Oh, I get it every day.
Yeah.
Every day. The number one thing parents and especially mothers say to me after the baby is born is, "I wish we had known more about postpartum, and I wish we had gotten more resources for postpartum support." And that's not to say that everyone has postpartum depression or anxiety or anything. It's simply just
Care.
we didn't expect this.
Right.
We didn't know. So there's so much information and resources about the birth because it's very unknown and there's a lot of fear surrounding birth a lot of the times. And so there's a lot of classes and this and that. But when it comes to the nitty gritty things about postpartum, there's often a lot of information about caring for baby, but just for mom and
Right.
parents.
Right.
I had a woman who had come to me. She was 8 weeks postpartum and had not sat down once since birth. And her OB had said it's just fine.
8
And I
weeks?
was sitting there saying it's not okay. No, we can actually help. Um, so there's just sometimes it's just brushed off, and it's really unfortunate because there are resources out there, and there is a village, and there is support for baby, for mom, for dad, for parents, for the family, and that's part of the reason I love working with babies is because it serves a whole family unit. And I know that if baby is going home and is more comfortable and is feeding better and not crying so much, then it's going to serve the whole family. And that's so important.
I mean, it really is in a time where your family is under stress anyway. There's this
Mhm.
new addition, nobody's sleeping, stress is just everything is high. Emotions are high, stress is high.
Yeah.
So, yeah, if the thing that you are supposed to be keeping alive is comfortable and happy, that really does reduce
Mhm.
a lot of those feelings of not being good enough or you don't know what to do.
Exactly.
Like it serves everybody for sure.
Mhm.
My husband has a friend whose baby cried all night long for the first 10 months of life.
Oh my goodness. They are champs
Yeah,
for
yeah.
making it through, but that's
That's
hard. Yeah,
rough. Yeah.
that's really
I will say my son on the opposite side of that, I didn't know that he was having some issues that we'll get into a little bit in just a few minutes, but he was the opposite and never cried. He was so
yes.
content. He's like, I'm
Good
good.
boy.
I haven't eaten all
Yes.
day, but I'm totally good.
Yeah. Just such a sweet boy.
He is the sweetest. I love him. Okay, so let's dive into the whole reason we're on here today, and it is just to
Mhm.
talk about some common conditions that babies have or develop.
Mhm.
Um, I say the word common very specifically because I
Yes.
want to make the difference between common and normal. because they are
Mhm.
not the same.
Absolutely.
Yeah. Okay, so tell me a little bit about latch problems, um, and how you treat it.
So when sometimes parents will come into my office and they'll say, feeds are really long, or I'm hearing some clicking, or it's really painful still, or babies maybe not, growing on their growth chart, or simply they're coming on and off, they're really not feeding. I can't breastfeed, or even on the bottle, they're getting a lot of gas. So many reasons. So what I do is assess baby. So my role, the patient is my baby in that scenario. And I really love working with lactation consultants in that scenario as well, because they can do an amazing job working with positioning while nursing or feeding on the bottle. I love co-managing and working with other practitioners. I think it's wonderful to serve that way. But so my role is to look at baby. And a lot of times anytime I'm looking at latch, I'm looking obviously inside of the mouth, but important pieces that I'm looking at are what's happening in the neck, what's happening in the cranium, and what's happening in the digestive system, because those things are all very connected. Of course, when looking at latch, I'm looking at whether there is what's called a tongue tie or a lip tie or even a buccal tie, which is the cheeks, and which just means that there's tissue that's restricting motion in those areas. And so that's like quite a big piece of my assessment. But also looking at the jaw, people really underestimate, like TMJ issues in babies.
It's
it's
a real thing.
it's a real thing. If you think about how much they're nursing or feeding on the bottle, how much they feed, they're using their jaw a lot. And if there's any asymmetries, if they had any uterine constraint, if their delivery was a little bit challenging, they will often have asymmetries in their muscles. And sometimes moms will say, oh, if I put them in this position to feed, or if it's on this side, they won't feed well. They'll come on and off. The other side is okay. And so I'm looking to identify which area is affecting that. And it's very specific. There's a lot of different reasons for it. Um, a lot of times it goes hand in hand with the muscular tension in the neck or in the jaw. And so what I do is I go in and assess all that, and then maybe we need to make a referral, or maybe we can just treat conservatively. And I do a lot of work on the muscles and loosening things up, a lot of work in the fascia, a lot of work on the cranial bones. And it's very interesting, the connection with the digestive system, because if there's any straining with gas or in making a bowel movement, the baby will thrust their tongue. They will not suck well. So I'm always treating that no matter
Interesting.
what. Yeah, it's
Interesting.
very closely connected.
I read when I was struggling with latch issues, I read that that suck reflex actually starts to develop at 20 weeks in utero.
Exactly.
And so if you think if pregnancy is 40 weeks long, baby is already learning to suck 20 weeks prior to being born, which is amazing. However,
Amazing.
in my case with my son, he was tongue-tied. It was pretty significant by the time we actually had it addressed. Um, that means he was learning to suck with an inefficient tongue or inefficient movement for 20 weeks before he was even into this world.
Exactly.
So if you can, for the listeners, if you think about that, how tense it must have become because he had to adjust for this restriction in his tongue, and he had to I mean his instinct is to survive, so when he was
Of
latched,
course.
it was his lips were doing the work, his jaw, you know what I mean? It wasn't his tongue that makes it the most efficient scenario. And for me it was massively painful.
Yeah, I know. It's
Right?
hard.
And for me, again, I swear I was in this free state. I had no idea. I had no idea. I would go to my midwife, they would weigh him, he was gaining weight. okay, until
Yeah.
he wasn't,
Yeah.
right? Until he was like, I'm exhausted. I am so tense.
Mhm.
This is so uncomfortable. I cannot do it anymore.
Mhm.
And I think that a lot of people are probably very much in the same state as me, or they end up shifting to formula, which is fine because there's something wrong, but they don't investigate further. And for me, it was really important to breastfeed, and it was really important to get my son back sort of on track in that way. It took a very long time
He
because
did
by the
so good.
time he's so good at it now, it took 9 months. But it probably would have taken less, but I needed to feel more confident in that scenario. But by the time we got his tongue tie, you and I had realized that he had lost his reflex to
Yes.
suck, and it became a choice, which was much harder to get him back to the breast.
Yes.
But we did it, and thank you
Yes.
for that.
Yes.
So, I think a lot of women like myself feel like breastfeeding is supposed to be so natural, and you're supposed to
Yeah.
just like pick it up like it's riding a bike. You do it once, you're good.
Yeah.
Um,
Mhm.
but it really isn't. Both you and baby need to learn it. Need
100%,
to,
yeah.
yeah, it's like a whole new skill. And you, if there's something not quite right, you
Mhm.
don't just have to go to your pediatrician. You can go to somebody like you, an osteopath, a chiropractor, Una, the clinic that you
Mhm.
work in has been so amazing, and I feel like they serve uh Etobicoke really well.
Yeah. Yeah, and Newmarket, there's one in Newmarket as well, which
Yeah.
I've been, a practitioner at as well. It's a really, I think it's well worth to touch on latch. And that's and just coming off of your story, because I think a lot of people can probably identify with the story of, oh, try breastfeeding. It's supposed to be easy. Your breasts have never been used this way before. It's completely new.
It is not easy, and it's not easy in a state when you're not sleeping and your baby is crying and nobody knows what to do.
Yeah, I hear you. And babies actually learning too. And
Yeah,
so also get a lot of patients come in saying, "Oh yeah, this my the midwife checked it. There's no tongue tying, or no one has checked anything in 5 months." Or sometimes it's okay to get other opinions. It's completely okay if you feel and trust your intuition. A mother's intuition is so valuable.
it is
But when it
real.
comes, yeah, it's real. It is
Yeah,
real. Um, when it comes to tongue tie, I think it is worth touching on specifically a little bit, because I think a lot of people, this term is thrown around a lot. I was with a patient yesterday, and was talking about ties, and I said, there might be a small tongue tie. We're going to work on it conservatively. And I said, do you know what a tongue tie is? No. Like, okay, perfect. I'll explain it to you. But a lot of people hear these terms and it may not be very clear. So when we have ties, there is regular tissue underneath our tongue or between our lip and the gum tissue. Um, and those can be shortened, and it can restrict how the tongue moves and how the lip moves. So maybe it's hard for the lip to be flanged, and maybe it's hard for the tongue to do this beautiful sort of mermaid motion and extract milk efficiently. So, like you said, there is compensation that needs to happen in that case, because babies are really good at getting their food. It's
sure.
survival. Yeah. So a lot of times, if I even notice some jaw tension that's very significant, I can almost identify a tongue tie without looking in the mouth, because I know that they're using their jaws to chomp more, basically, which means that's not going to be so comfortable. Um, and then, what we want to do ideally is work on the tissues to stretch them out inside the mouth, and then outside on the jaw and head and neck area, which is something that I do in clinic. And when I feel as though the tongue tie needs to be released, then we refer to a pediatrician who can do the release with scissors, or a dentist who can do the release with laser. And so that's sort of the process of that. I think it's really important for people to know of all the options because there's sometimes there's shame. Oh, I can't, my baby and I'm not able to do this for my baby. And it's just simply not the case. It's not like that. There's support, there's things we can do. And so it can be a really challenging journey, but there is so much that we can do. We always, even if we're at the point of doing a release, it's really nice to do body care beforehand and then, of course, after the facts. Because as you said, if we're learning how to, suck at 20 weeks in utero, we're not learning how to suck in an efficient way.
Hmm.
And so by the time the tongue is released, a lot of times what happens is we release it and it's not magically fixed, which is also sometimes if that's not clear, that can be discouraging. But there
Sure.
is a whole aftermath that needs to be done. So there's exercises. It's not an easy road, but it can be very well worth it in that scenario.
Yeah, I agree. I have a couple of friends whose babies were tongue-tied. I don't know if maybe it wasn't that significant. She kind of
Mhm.
just worked through it. She didn't want to have it released. And it ended up working. Like he ended up
Yeah.
getting it, like maybe just, continuously trying. For me, in my case, it was
Mhm.
so painful that it was impossible. And then he was losing weight because he either
Yeah.
became like uninterested because he knew
Mhm.
it was exhausting him,
Yes, exactly.
so that wasn't an option for us. But we've learned that my husband is actually tongue-tied.
That's
And
interesting.
we actually learned that his father is tongue-tied, and we learned that his sister, who's younger than him, was tongue-tied, struggled with digestive issues and colic as a baby.
Also, it's a good point, hey, because sometimes people will say, I really don't want to opt for it. And absolutely, my opinion is it is the parents' decision. This is their family, that's completely fine. But just some things to note. When we have a milder tie, we can usually treat it with conservative care. And so there is definitely a continuum. And it just depends on the function of the tongue. By the time we get to like the severe ties, it really helps to get that release. But one of the reasons why we want to address it, whether it's with conservative care or whether it's with a release, is that it's not just about nursing. It's also, okay, maybe we don't have a good latch, so then we get a lot more air going into the digestive system, and maybe that's really uncomfortable for baby. And then that's all how we're starting their digestive journey, actually. And from there, okay, maybe once we get teeth, we need to be able to clear food with our teeth. So we're maybe dealing with more cavities later on, and oral hygiene might be
Hmm.
an issue. The tongue itself, the resting position of the tongue is typically on the roof of the mouth. And at infancy, that actually shapes the roof of the mouth.
Oh,
So I often
interesting.
will find anatomy is the roof of the mouth can be very high in tongue-tied children just because that's how the development went. And so their gag reflex tends to be more sensitive. And so that's part of the training as well as desensitizing that gag reflex because once we start solids, it can be tricky if you're gagging on food all the time.
Sure.
And so there's and then of course, like you mentioned, there's the speech sometimes, and I've seen it as well, where I get a 4 or 5 year old who has delays in their speech, and then they've later found tongue, lip, or cheek buccal ties. So it's something to pay attention to, certainly.
It almost feels like latch, because that is the sort of the first part of motherhood in terms of
Yeah.
breastfeeding and whatnot. It's almost like that's the indicator of this like big cascade of things
Mhm.
that could potentially be going on, you know,
Yeah,
for that child and like into adulthood.
absolutely. I
Yeah.
actually believe that a lot of things that we see into adulthood that keep cropping up are often from infancy.
Yeah, I agree with you. I feel like we could
Mhm.
probably go down that road in another episode.
Yeah.
All right. Is there anything else you want to touch on when it comes to latch?
No, I don't. I think No, unless you have any more questions for me, we're good.
No, I think on that one, if, if the only advice I could give, just based on my own experience, if,
Yeah.
if breastfeeding is important to you, just keep trying, be persistent, get the help, not necessarily from your pediatrician, get the alternative
Mm,
help, get more
yeah.
input from practitioners, not from your friends, not from your peers, not from your
Mhm.
parents. Um, they don't know your relationship intimately. Get somebody who really understands the mouth, like you said, the cranial bones, the
Mhm.
tension through the body. Just get somebody to look at it and just keep working at it because it can happen for you.
Can I just say you were such an incredible patient that way? Like you were determined. You really took your beliefs into your own hands, your healthcare, your son's healthcare into your own hands. And it was like, it was really wonderful to see that journey because it was not always easy, if I can just say that.
It was not easy,
Wasn't
not at
linear.
all.
And it was up and down, and just seeing your persistence and tenacity, and just knowing also the surrender it took at times. Um, it was a really beautiful journey to witness.
Oh,
Yeah.
well, thank you. You were a part of it. You helped us get there. You helped us get there, which was, I'm very thankful for. And if my husband didn't, he always says that you and I are witches.
I know that.
And he's always like, if I didn't believe in witchcraft, I do now.
That's amazing. I like the word sorceress.
Oh, I like that too. I'll remind him of that the next time he
Okay.
says that about us. All right, on to the next common condition, but not necessarily normal. Torticollis.
You got it.
Okay.
Yeah, it's something I see a lot, hey? And it goes hand in hand with the next thing we'll talk about, which is plagiocephaly. But basically, torticollis is just a shortening of one of the muscles in the front of the neck that's causing a baby to prefer one side. So they're looking to one side a lot, and therefore it becomes difficult for them to look the other way. And then what happens is their muscles start to become imbalanced, and it becomes uncomfortable for them at the end to actually turn in their full range of motion out of that. And
Mm.
then that can impact breastfeeding or feeding, depending on the positions that you're feeding in. It can become very uncomfortable for baby. And so this is something that is quite common. I will say, okay, so I won't get into everything, but just let's just call it favoring of one side because it's not always due to this one muscle. Sometimes there are other reasons for it to crop up, but it's something that certainly can be treated, and it's quite important, I would say, to be treated because if not treated, of course, there's this discomfort that can progress and continue on in life, but also in infancy can cause this flat-headedness
Mm.
called plagiocephaly.
Is it because
So
their head is to one side only ever?
exactly. So the cranium is so incredible in an infant because it is the joints lines, the sutures of the cranial bones are not fused, like they are in adults at infancy. They are mobile in order to allow for the brain to grow so rapidly as it does in the first year. And so that being said, it allows for a lot of movement. So if we're constantly putting pressure on one area of the cranium, what can happen is that area can shift the cranial bones and it can mold the cranial bones and it can cause a flattening. So the earlier to get to that piece, because it's bone, it's a little bit trickier to deal with than say a muscle. Um, the better outcome. So what I do is I go in and similar to what I do with a chiropractic patient as an adult, I assess the spine and see how the spinal segments are moving relative to each other. And if there's an area that feels restricted or sort of stuck, then I do a very gentle approach to help to help gain the mobility back. So unlike what some chiropractors may do with regards to doing an adjustment with an adult, the adjustment with an infant is just a very, very, very gentle, sustained hold. And so there's no fast movements with the babies, there's no cracking, popping, anything like that, but we are still gaining the mobility by introducing some movement in through the spine. And that can really impact a couple of things, their range of motion, the comfort level, but also it really impacts tummy time a lot of the time. So a lot of patients will say, my baby hates tummy time, but what baby likes tummy time?
My baby
Some
liked
don't
tummy
mind it.
time.
Yeah, some don't mind it
Yeah.
actually. So I will say that when we have a baby who's favoring one side, we can get irritation at that one side. And so that's where the nerves come out between the vertebral segments. And so maybe there's a little bit of irritation, maybe there's inflammation. And then we ask the baby to put their head in complete extension when they're on their tummy, and it's
Right.
just actually jamming the joints.
Oh,
And so it just hurts. And so
yeah.
baby cries. And I always find that once we work on that side that they're favoring, then tummy time tends to improve quite a bit.
So that could be a big indicator, like that tummy time is uncomfortable. I mean, it's uncomfortable
Mhm.
because it's uncomfortable for babies because it's new, but
Sure.
if it is continuously uncomfortable, it might be
Mhm.
worth coming to see a pediatric chiropractor. It might be worth coming to see you
Mhm.
to assess torticollis.
Yeah, at torticollis, any sort of favoring of the neck. And also, if you can imagine, if baby really doesn't like tummy time and that's prolonged, maybe that's pushing milestones at that point. So
Yeah.
maybe they're not going to roll because they don't want to be on their belly, or maybe their crawling is delayed because they don't want to be on their tummies and their necks are just not strong. Those kind of things. Sitting, sometimes I'll see babies always putting their head down. So it's hard to gain their balance because they don't want to have their neck up in extension because it's uncomfortable. So there's definitely like indicators as
Yeah.
to, hey, maybe it would be helpful to get some treatment for baby.
So, do you think that this is one that goes left untreated far too often?
For sure, plagiocephaly, which is the flat-headedness. I just wish so much that patients, providers would send them to me earlier because it's one of those things where the earlier it's treated, the better. A lot of times in that fog that you mentioned, that time where we're frozen, we're not really paying attention to whether baby's looking left all the time.
Right.
It's just not something, unless we say, we see, oh, they don't latch on my right breast at all. Then maybe there is an indicator early on. But if it's first baby and you're just trying to figure everything out and you're in this fog and your hormones are everywhere, it's not necessarily the first thing that comes to mind. So in that sense, I will say, yeah, usually I'll see babies around 2 months, parents saying, oh, I think if I look back, I think
Mm.
they were probably doing it. I have pictures of them, at 1 month consistently looking left. I just didn't realize, and it's totally understandable, but something to be mindful of, certainly.
It's interesting because when we do this again, my husband and I, we have both agreed that because you don't know everything and you are like you're
Mm,
watching so intently, but you're also so, crazy the first few months that we've already agreed that within the first month, new baby will be assessed by yourself.
yeah.
I told my husband, I'm like, wherever we're moving, I am driving to Toronto to see Alima because you're right. Like, how can a parent who doesn't specialize in any of these things absolutely know?
Right.
And
Yeah.
I refuse to be made uh felt like I'm nervous all the time about my kids'
Yeah.
well-being because I'd
Yeah.
rather be overcautious and know that they're developing well than like
Mhm.
sit back and wonder.
100%.
So,
100%. And what's the harm, right?
really no harm.
Yeah. Well, yeah, when it comes to the flatheadedness, I also get a lot of providers saying it'll be fine. Say to parents, if they're noticing that, do come in as early as possible because
Yeah.
there are things that we can do early. By the time we get them at 8 months, from it's frustrating, right, for parents when they said, but I would have come in earlier if I had known, but it's sort of brushed off. It's one of those ones that gets put off. And so it's nice to know that use all your resources. There are people out there. I know it's not always easy to know everything, but it's one of those things where there are people out there that can do something,
Yeah. Yeah,
right?
absolutely.
Mhm.
Absolutely. Okay, next one.
The plagiocephaly is one that like I said, we talked about it, and it goes hand in hand with torticollis. I cannot treat it without treating the favoring of whatever way the baby is looking. What I will add is that sometimes it we can work on the cranial bones, and it is a stubborn one. It requires what I do really is go on the joint lines and make sure everything is as unrestricted as possible so that when there is growth, when there's a period of high growth, because the growth goes in spurts, then we hope that the cranium will sort of round out during that period of growth. And so I always say, let's do a trial of X amount of time, and then we'll assess. That'll give us enough time to assess what we need to do from there. If we really are dealing with a severe case, now it's also good to know, I'll just throw in that it's largely aesthetic.
Sure.
So most of the time, it's really up to the discretion of the parents as to if it's okay, if you're comfortable with it, it's not going to harm your baby.
Hmm.
However, there are some red flags. If we see asymmetry of the eyes, if we see facial structure at all, asymmetry of the ears, one being higher, lower, or set more far back, then there could be really compressed nerves and things like that. So we need to get that seen quickly. Um, but when it comes to the plagiocephaly, if we're dealing with the severe case of the flat-headedness and it's being very, very stubborn, sometimes we need to get assessed for a helmet. And so
Yep.
that's the next step. So our goal is to try our best to stay out of the helmet because it's expensive and it's a pain to deal with.
Sure. And
It's
I'm sure
not
it's not
fun.
comfortable for for the baby as well.
To be honest, it's usually tolerated quite well.
Mm.
The helmets nowadays, like you can get ones that are so light and so well crafted that yes, they're more hot. So
Mm.
that's where the discomfort can happen. The older ones were thicker, and I definitely saw some change in the biomechanics. The newer ones you can get are thinner. They're quite expensive. Um, but it's it's babies wearing it 23 hours a day. Um, you're just recently taking it off to bathe and to wash it.
Wow.
It's a lot of care. Yeah, so it's not always easy. So we try our best, but if we need to go to the next step, that would be the next step.
So again, just kind of coming full circle and saying there's no harm in having a wellness check on your
Yeah,
newborn baby because you don't know it all, and that's okay.
totally okay.
Yeah.
We can't know it all, as
No.
mothers. We can't know it all as mothers.
And you want to, though. You want to because it's your baby, right? It's almost ego that's telling you, wait a second, you brought this thing into the world. You know everything,
Mhm.
but it's not true. Like you said, you need to
Yeah.
find your people.
Mhm.
Yeah. All right. This one, let's talk about digestive upset, fussiness, and colic.
Yeah. This is a huge one.
It is.
I am almost surprised when I have an infant come into the clinic and parents say, there's no digestive issue. It's almost surprising because they're coming into the world and they're using their digestive systems in a new way. And it's a huge adjustment. And the thing that surprises me, I think, is that people don't know we can really help it.
Right.
This is one thing that is I can confidently say we can help this readily, what I'm really looking for is, are they uncomfortable with their digestive system? So I know you hear these things where, oh, my baby doesn't have a bowel movement for a week, just say.
Oh,
Okay.
that's all over the internet. That's normal.
Right.
Or they're like,
That
oh,
doesn't
breastfed
help.
babies
That's
can go a
easy. Yeah.
week. I'm sorry. Would you want to go a week?
Right. And
Right.
the reality is, my next question is always, well, how comfortable are they?
Right.
And 99% of the times they're kicking, they're going red, they're crying or fussing, or they're wiggling or they're grunting. These are all signs of discomfort. Or we can't put baby down. These are all signs of discomfort. Constantly needing to rock them, things like that. That's a sign of discomfort. And so almost in every baby I treat the digestive system first. Because it's like, I mean, you know better than anyone, but it's like our second brain. It's
Yes.
got, oh, it impacts the entire body. So
Yes.
if we can balance the gut from the get-go, I will say my treatments always go much smoother from there because it just shifts the mood of the baby.
Absolutely.
We're more comfortable. Um, I would say maybe of all the babies I've treated, there's a handful who parents come back and say, oh, they were a little bit uncomfortable, like fussy after that, but it's so rare. And it's just because there's shifts happening in their digestive system.
Yeah.
Usually it's simply just release and comfort. But at the end of the day, even those babies who experience discomfort felt better afterwards, the next day or so forth. So I think the gut is like, it's to me, it's such a central component of a baby's life. I mean, human's life.
Sure.
And in balancing the gut. And like I said, there is this connection to even the way the tongue moves. When we're straining, it will change the feed. But as you can imagine, if you haven't made a bowel movement in a week, most of the time, I can say I probably have had two patients where I'm like, okay, maybe it's okay. They're not uncomfortable in any way, but it's very exceedingly rare.
Yeah.
Um, so what I do in that scenario is I do some soft tissue work on the intestines. I will work on areas of the fascia around the liver, and I work around the ducts without getting into it too much. The sphincters and so forth to essentially just make the area patent. So there's no tension. We want to alleviate tension when matter is going through their digestive system.
Hmm. Hmm.
And it can change a baby's life.
Okay, so I have a question about this. How common is it that a baby, an infant, a newborn, would actually have a sensitivity to mother's breast milk? I'm just curious to know before mothers make that assumption that they're gassy or, constipated or maybe the opposite, maybe loose bowels, um, before they consider it being a lactose issue. Could it just be some tension through the digestive system?
Absolutely. I would say it's exceedingly rare.
That they'd be sensitive to their mother's milk.
Exceedingly rare that they would be lactose intolerant.
Mm,
Now, whether there are other intolerances happening, sensitivities happening from something that mom is eating,
mm,
that I think is quite common.
okay.
And it's something I do pay attention to. And it's really interesting, actually, because I can almost identify if there is an infant who has a sensitivity. What I'm looking for in that sense is our work not really progressing? Is it regressing a lot of the times? Gets better for a few days, gets worse, and this goes on, which is sort of typical to have, a plan of management where we're always improving, and there's little dips along the way, but it should be improving.
Hmm.
If we're having a scenario where, it's good for a couple of days, but it's continually regress. And I can almost feel that when there's inflammation inside of the digestive system, actually, there's
Mm,
so much gas. It's different when there's reactions happening.
okay.
It feels different in the gut. Eczema.
Oh,
Eczema.
yes.
Yeah. So that one is like very, very tied to the gut.
I mean, that's tied to the gut in adults.
Exactly. Yeah.
I like to say anything that comes out on the skin isn't
And
coming
yeah.
out in your bowels,
Hmm.
but should be.
Yeah.
Yeah.
Yeah. So same with babies.
Yeah.
And that connection, I don't think is really made clear in all facets of healthcare. However, when treated, it can really be impactful. So I will say this, if we're hitting a point where usually around a 4 week mark, if I'm not seeing progress in the way that I would typically see progress, now we're investigating some other things.
Okay.
Are we seeing a naturopath? Are we doing an elimination diet? Are we getting an IgG test from our naturopath? Are we, what are we doing? Are we, investigating what's going into baby and potentially what they're reacting to within the milk? Not to say that they're lactose intolerant
Yeah.
necessarily. Yeah.
So interesting. Okay, next question for you. Babies grunting all night long.
Hmm.
Lots of people say that babies are just grunters. They're just loud in their sleep. So you
Hmm.
did mention that grunting is a sign that they're uncomfortable.
Absolutely. Yeah.
So would you agree that if they're grunting all night, that's not a baby that's sleeping soundly, that they're
No,
uncomfortable?
that is something that I would like to see improve. That
Yeah.
is not something that, to me, that's discomfort within the intestines.
Yeah, that's good to know because again, that's something that I was told. I was like, my
Mhm.
baby's sleeping right next to me.
Yeah.
And I'm like, wow, this kid is loud. We're all supposed to be
Yeah.
sleeping. He's loud, before he had his tongue tie released. And everybody, I talked to my sister-in-law, I talked to my mom, my mother-in-law. They're like, oh yeah, babies are grunting. They're loud at night. So that's good
Mm.
to know because I can't be the only person. I'm not in a unique situation,
Yeah, no,
who
for
are being
sure.
told that's normal.
Yeah, no. A silent baby is a comfortable baby. And not to say that they won't make noise and they won't, coo and they won't cry for when they want something. Their needs to be met.
Yeah.
But their noises mean something.
Yeah.
Whether it's a specific cry for when they're hungry, or a specific noise for when they need to be burped, or a specific sound for when they're tired, or they're grunting because their digestive system is tense. That
Mm-hmm.
all these things bear meaning. So I'm constantly listening to baby when they're in my clinic. I'm constantly listening to it. One of the things that, just since we're on the topic, that is very commonly missed is when babies need to be burped.
Mm.
Um, if a baby is constantly, that's them having trapped air in their stomach. And sometimes babies who are dealing with sensitivities in the diet, or just a lot of air coming in because their latch is not solid, they have excess air in their system. And if we don't, they're not comfortable probably, but if we don't burp them, they spit up a lot. Maybe they're projectile, spitting up or vomiting, and maybe it goes down into the intestinal tract, and then we get more tension, like more gas and tension in through
Right.
there. So it's one of those. Sometimes you need to burp baby 3 or 4 times during a feed.
Yeah. I mean, their
That's
stomach's only
okay.
this big. They can't be taken in too much,
Yeah.
especially if there's other issues going on. Quickly, I want to just ask about a latch thing. Is it
Mm-hmm.
possible? So, like, if you've just latched your baby and you think everything's fine, but then, you hear them, you hear the latch come off,
Mm-hmm. Mm-hmm.
but they are still physically latched to you.
Yeah.
Are they able to get that good latch back on their own, or is that the indicator that you need to unlatch and relatch?
That's a good question. I think you'll be able to assess that based off comfort and noise.
Okay.
So if there's like a click and then you don't hear it anymore, and you can feel the milk being extracted pretty well and their latch is deep and you're not in pain, then maybe that's fine. You don't need to unlatch them. You don't need to mess with that.
They've adjusted. Yeah,
They've
okay.
adjusted. But if it's constant clicking and maybe we can feel that they're sort of suckling with a shallow latch, and it's, you can kind of tell, and they're extracting milk better than other times.
Big time you can
Um,
tell.
yeah. So that case, I would take them off.
Okay, coming back to digestive upset, I feel like this is like the biggest thing.
I think so. Yeah, it's
I just
probably
feel
the thing I
like,
treat the most.
yeah, I feel like every baby I've ever come into contact with struggles in one way or another
Mhm.
digestively.
Yeah.
How could it not, right? Like you've got all these
Right.
new things introduced into the body, it's getting used to it.
Yep.
Also curious to know, not that you would know this, but is this setting your baby up to have digestive issues or like the beautiful bliss of great digestive system later in life if you are allowing them to understand what it feels like to have no tension through their intestines, right? When if it's being
Yeah.
treated or constant tension.
I can only speak on my opinion on this because there really is not research based off of this. However, I really believe that it's very valuable to give them the sensation of what it feels like to be comfortable from as early on as we can, because it's really interesting. And I know my husband won't mind me saying this, but for example, he had like digestive issues, reflux, things like that. And he was 17 when we started dating, and he still at that time was dealing with this, and he thought it was normal. He thought it was just normal. That was baseline. That was
Right.
typical for him. And that was normal. And to me, only later in life when we were, eating differently and so forth, when he was introduced to those things, did he realize how awful it
He was
was for him.
feeling.
How
Yes.
awful and how much it affected him and how it affected his immune system and how it affected his skin and all of these things. And he had no idea. And so I think if we give our little ones the same way we give ourselves a good basis and a good foundation for our bodies, not only to build from, but just also to understand our bodies and to know, oh, this is what doesn't feel good, and this is what feels good, and this is how I should feel on a normal time, comfortable on a normal day, and to be able to identify and have that awareness from an early age is really a gift.
Yes, I agree with
Mhm.
you. I agree with you. I definitely plan on talking to my kids about that all the time. And you know what?
Yeah.
I know this is going off topic, but like thinking about just food as well. It is so important
Mhm.
for my kids to understand when they're full and when their body
A
doesn't
big
need
one.
anymore, right? And when
Mhm.
they're hungry and when they're truly hungry, food is
Mhm.
such a funny thing in our culture. We use it as reward. We use it as a social thing. We use it, you know what I mean?
Mhm.
Like we
Mhm.
use it in lots of ways, good and bad. It can be,
Yeah.
a problem for some. It can be, I mean, it can be a problem for a lot of people. And for me, just listen to your body. You know what I mean?
So important. It's so important.
Yeah.
And that's why I think it's so funny. Parents will come in and say, oh my gosh, people think like it's so crazy that I come and bring my kid in for all this self-care. But if you can give them that awareness, my kids come in to me and say, Mommy, can you treat my liver?
I
I'm like,
wish I had
"Really?
the ability.
Popcorn, can you massage my jaw before I go to bed?" So just to have that awareness at 7, 9 years old, I think it's a gift because then they'll be able to identify it later, which is very valuable.
I
Mhm.
agree. I feel like I have cousins, my mother, I have aunts that have lived a very long time struggling physically
Yeah.
and have no idea that, like you said, your husband's baseline was discomfort. So unless it got worse from there,
Yeah.
he didn't know. And I feel like that's, again, not a unique story. I work with a lot of women.
Yeah.
And who wants to be 50 and trying to retrain all the stories that come along with feeling that way. You know what I mean? All the beliefs they've created around food because they've
Mm.
eliminated everything out of their
Yeah.
diets, just to feel some kind of good. So, yeah, if you can give your children at a young age that ability to understand their bodies, that's an incredible gift.
Mhm. Yeah, I really agree.
Yeah. Okay, let's talk about birth injuries. Number 5, common condition, not necessarily normal, but you can fix it.
Yeah. I can really help with some things. I'm not to say that I'm going to fix a broken clavicle, let's say. But that being said, a lot of things are missed during a birth, and that's the reality. a lot of times parents will come in 3, 4 weeks post birth saying nobody knew that this baby's collarbone was broken because they're only seeing it now that there is a callus, now that the bone is rebuilding and there is a bump there. And that's very, very typical. Sometimes we'll see some, oh, my only baby only moves their right arm. And then realizing that the way that they were taken out during the birth was hard for the baby. So things like shoulder dystocia, some nerve damage sometimes can happen depending on how the baby was taken out, broken bones sometimes. These things definitely do happen, and a lot of times babies don't complain about them. We just
Wow.
see the effect afterwards. And so, even like if you like you said at the very beginning of this talk, even in the best of times, in the best of scenarios, this is like a big deal for a big transition for a baby to be born, simply
Yeah.
to be born. And then if we stray from that even a little bit, it can be quite a challenge for a little one. And so what I'm dealing with oftentimes is the aftermath of some things not even being known or not being caught during the birth. There's so much happening. Obviously, mom and dad, you probably wouldn't know even how baby was taken out. A lot of times they'll say, do you know the position they were in when they were, taken out either C-section or vaginally? And it's just not what's being paid attention to at that time, understandably. But a lot of it doesn't get recorded in the notes either.
Right.
So we're just working based off of what we're finding afterwards. And so, yeah, a lot of asymmetries muscularly, a lot of tension that can come from that. And sometimes it's reintroducing, like working on the other limb that may not be being used as much,
Hmm.
stimulating the nervous pathways and so forth is very important for those babies as well. So yeah, just birth is this beautiful, very difficult feat for a baby.
Yeah.
And I like some people, it's so normalized. To me, I'm always like, this is magic. We grow
Yes.
a human
This
from
is a
nothing.
miracle.
It's a miracle. And it's so normalized. But it's like this big, huge, big deal.
No kidding. This little
Uh,
thing that's been in you for 40 weeks only like thinks that's his whole world. Thinks like this is great, cushy little
Mm,
waterbed. Bam. Where the
yeah,
heck am I?
yeah, yeah, the whole thing. It's very sci-fi to me. Like we grow a human. Women are incredible. Let's first start there.
That's true.
And then yeah, so by the time we go through birth, the process can be, I don't like to use the word traumatic necessarily, but it can be very challenging. And so identifying, are there weaknesses? I'm always assessing reflexes, and that'll tell me about their nervous system. I'm assessing primitive reflexes as well with the infants. And so all these things tell me what is happening with baby. First of all, are we all okay? Sure. But also, oh, is the left responding more than the right? What can we do to help with that? That kind of
Mhm.
thing. Mhm.
And it ultimately helping those things early as possible, all five of these conditions, helping them as early as possible, set your baby up for proper development.
Yes, proper development and also comfort.
Yes.
So I also treat adults, and I mean it's not the main part of my practice anymore, but I did for a good decade as well, and I really enjoy treating moms postpartum. But most times people will say, when I get stressed, my upper back gets really sore. Or, I had a really hard week, I'm getting headaches again. Or, I'm grinding my teeth, my jaw hurts. Or whatever it may be, that's your thing. And I feel like most people will say that they have a thing. But any period of stress, essentially, can really impact your thing. And so I believe that to often come from very young ages. And I think if we can address that from infancy or from childhood, it can really help limit what you experience as an adult.
I'm very happy and grateful that there are professionals like you who take the time to look in a lot deeper. Um,
Yeah.
because I think all mothers want their babies to be comfortable. And I think if
Mhm.
they knew that this care was available, like I had
Yeah.
no
Yeah.
idea until I met you
Mhm.
at Finn's 4.5 months old. Like,
Yeah.
no idea. And I just feel like if more women knew, they would feel more confident with the way
Mhm.
they take care of their babies. They would get to know their babies faster because their
Yeah.
baby's like true self is going to come out when they're comfortable.
Yes. Yes.
Um, and I think that's important. And I think it's important for the mother's journey. And I think that's important for the baby's journey as well.
Mhm. Absolutely. I think that's a little bit underrated that, one of the things I really see when we alleviate comfort is that now baby can explore the outside world and they
Right.
can express their own selves because if they're so concerned about what's happening internally, it's very difficult to do that. So then we often see, oh, like a boom of milestones, happening or development happening or changes in noises happening and things like that. So they can really ex- come into themselves in a
Yeah.
way.
And that's so
Yeah.
lovely to see. It's been like the greatest joy of my past year is
Yeah.
just watching Finn like blossom.
Yes,
That's amazing.
absolutely.
That's amazing. Do you have anything else you want to add to these conditions?
No, I just want to thank you so much. It's been
Well,
such a joy getting to know you and Finn and the family. And I love how you approach health and healthcare. And yeah, I just can't wait to see what's next.
well, thank you. And thank you so much for coming on.
And thank you so much.
If you're looking for more information on how you can work with me, you can head to my website at www.michellescarlet.com or find me over on Instagram at michellescarlet_. And this information will also be provided in the show notes.